Hello, I am back to tell you the results of talking to the neurosurgeon, just like I mentioned on the last video. And the results are as expected. So basically, I need surgery again. This is not because my one CNI is worse, thank goodness. This is kept well. It's because of the other symptoms. So fortunately, I do have a little bit of a window. It's not an emergency. I don't have to go into the ER and have surgery immediately. I do have a small window, but I have other symptoms that really make it necessary for me to have surgery at some point, probably better sooner rather than later. And for those of you that may have IIH like me, idiopathic intracranial hypertension, those symptoms basically are, and I may forget some, but I mean, for me, it's major headaches. I have quite a stiff neck. It hurts even to just move it a little bit like this. And so I'm limited. I have already begun to experience falling. So I tend to tip to the left. So it's very difficult for me to turn. So if I'm walking, even with my cane, if I go to turn, that's very difficult. For example, emptying the dishwasher is quite precarious for me. And what I've experienced now after, over 30 years of having this condition is, and I'm sorry to be so blunt, but incontinence, for me it's minor, but it's in the evening. So these are issues, especially at my age, I don't want to be dealing with, honestly. But the minute that I have a lumbar puncture stops, and the minute that I have a surgery that works, they all stop. And lastly is problems with memory issues with trying to find the words. So it's very good for me to be doing these YouTubes because I force myself to find the words to express myself. Especially in the morning, it's much easier, but as I get tired, it's very difficult. But I forget words, or I use one word instead of another, which really confuses those around me. And then I forget, for example, we have a great time at home because my husband will play something on, social media, or will play something on Netflix, and he says, "Do you remember this?" And I'll go, "I've never seen this before." An episode of something, and I've never seen this before. He goes, "But you saw it yesterday, or you saw it 2 days ago." And I can watch the same episode of a TV series several times because I don't remember. Maybe towards the end I'll go, "Hey, I remember this scene. I've seen this before," but I don't remember it. Or I will have a conversation with my husband, and the next day it's gone. Or I'll be in the car, and we'll be going somewhere, and all of a sudden there will be a blank in my brain, and I will look at him because he's driving, and I'll go, "Where are we going?" So these are very usual occurrences, and I'm sure you have had these, and you can relate. At first I was quite alarmed by them. Now, as I know that they happen, I'm not as alarmed by them. But when I have a lumbar puncture, for example, and it's like a cloud is lifted, and I think so clearly, it's like, yay, I get really excited. And then as the headache returns and the cloud thickens, it feels like my whole world is dampening, I think is the word. It just becomes there's such a struggle to work every day. It's so difficult to just keep going and keep moving. Fortunately, it's progressive, so it's not completely all at once, I would say. But it's difficult, especially knowing what the other side can be. So again, I will tell you more, especially if you are an AAH patient and want to know more about this surgery. It is a surgery, again, that was done many years ago, and it's starting to be done again, so it may be a possibility for some of you. But it's only been done, only 2 patients have had it done as of right now, FYI. So there is it's been done very successfully, but there's no statistics rate of success as of right now. So I'm hoping that it will work for me. I will keep you updated. Thank you. Many, many hugs. And wish me the best. Bye-bye.